Welcome to Jersey Matters. I'm Larry Menti. Everything you need to know about the coronavirus on today's show from the New Jersey Center for Poison Control. Also, we'll take you inside the cold case unit at Monmouth County, and a pork roll company in New Jersey celebrates its 100th year. And now, separating the fact from the myth about the coronavirus from Dr. Diane Calello with the New Jersey Poison Control Center. Thank you for being back. I appreciate it. How are you involved in this?
So the New Jersey Poison Center is a 24-hour hotline, which people normally call if they're exposed to a poison or a toxin. But early in the coronavirus outbreak, we partnered with the Department of Health to provide a 24-hour coronavirus hotline through the Poison Center.
We've seen fear over this. We've seen some schools closing. We see the stock market dropping. People are going out to buy surgical masks. People are going out to buy food supply.
Right.
How much of that is unfounded?
Well, I think it's important to realize that right now our activity here in the U.S. is fortunately still very low. And the news can be scary. We're reading all about all kinds of things happening abroad, but some of the news is true. Some of it is meant to induce panic, and I think right now it's important to not panic.
Right? Why? It's important to not panic because the panic itself can be worse than the disease.
Absolutely. I mean, right now I am more worried about the consequences of panic than I am about the virus, which is, still much less of a threat in the U.S. than regular flu, which is rampant.
30,000 people died from the flu last year.
Right.
And we don't talk about that. The year before, in a particularly bad year, 60,000 people died from the flu, and yet people won't get their flu shot.
That's right. Exactly. When you lay flu compared to COVID-19, which is now the name of this virus, you're much, much, much more in danger of flu and a complication or even dying from the flu in the U.S. than you are from COVID-19. Let's
talk about COVID-19 and the coronavirus, because that to me is fascinating. The coronavirus is just a virus that when you look at it under a microscope, it looks like it has a crown. That's why they call it the coronavirus.
Yep.
But it's a very common virus.
It's a common group of viruses.
Yeah, and this is just a horrible strain of it,
That's right?
This is a deadly strain.
It's a strain,
So you can go to the doctor, right, and be told you have coronavirus.
That's right. Coronaviruses are a group. We know that, for example, the SARS virus was a coronavirus, and COVID-19 is a coronavirus. But coronaviruses cause things like common cold. So you could go to the doctor, get tested for just viruses, and be told you're positive for coronavirus, but it's not this coronavirus.
Let's come back to New Jersey for a second. No cases in New Jersey, right? Should we expect the worst at this point? I mean, you would believe that from the media coverage that this is coming, that we should have to be prepared for it. How much of that is true?
I think we're likely to see more activity in the U.S. because the virus spreads in people with mild disease. So sometimes people don't know when they have it. That makes it hard to fully contain. So we shouldn't be surprised and we shouldn't be alarmed if we see more cases in the U.S. And we shouldn't be surprised or alarmed if we see it in New Jersey.
You expect that?
I think that will likely happen just given how much the virus can spread without you even kind of knowing that you have it. But it doesn't mean that we should be preoccupied with worry or panicked.
Well, it's funny because I watched CNN, Fox News, I watch the media reports, and I watch ABC and NBC, and they constantly are telling you about the virus and how it's spreading and how it's going to come here and what but they never tell you what you can do.
Right.
Like they never tell you how you might be able to prevent it. Is there a way?
There are a number of ways. So the CDC, I have to say, has put out such a continuous stream of accurate information, and the CDC website contains a lot of resources. And one of those pages is something called non-pharmaceutical interventions. What's that? It's things you can do without drugs or medication to help protect yourself and control spread. It's common sense stuff, right? So it's washing your hands, it's covering your mouth if you cough or sneeze, it's not going to work if you're sick, it's avoiding contact with sick people, it's wiping down surfaces, it's all the stuff that we should do in the middle of flu season to prevent us from getting the flu is the same stuff that can protect you if you happen to come into contact with somebody with COVID-19.
It's funny, I asked a doctor one time, I said, how can you live longer? He said, do you smoke? I said, no. He goes, do you wear a seatbelt? I said, yes. And he goes, wash your hands more.
That's right.
That was so
washing
people
saves
hear that and don't realize just how important
right.
that is, what you're talking about. Are we prepared for it to hit New Jersey?
I think that we are. I mean, you know, the State Department of Health and all of the kind of powers that be in the state, in conjunction with the hotline, are staying abreast of all the information as it's coming out of CDC. And, you know, being kind of aware of patterns of infection. If there is somebody that may be entering the state who may be infected. We had a cruise ship that docked in Bayonne.
Right.
You know, you remember. And that was all hands on deck, no pun intended, you know.
Yeah, that was amazing how they handled that.
To try to address those people coming out. So,
yeah.
So I do think that we're really keeping a very close eye on preparedness.
We're almost able to learn from the mistakes of the West Coast because you just had a case where someone went to the hospital, they weren't tested for the virus immediately. Right. They was assumed they didn't have it almost immediately.
Yes.
So they could have passed it to a lot of the medical workers. And they apparently didn't have the medication, I guess, to treat it there. They didn't have the training or the medication or the protocol in place. I would imagine that's not going to happen in the rest of the country now. Right.
The case in California arose because you can't test everybody who thinks they might have COVID-19, or you will exhaust your resources for the more, for the people who really need the COVID-19 testing.
Yeah.
But in response to that case, the CDC just yesterday changed all of the criteria for testing. So even if you have somebody who maybe doesn't have a travel history that would qualify them for testing, if they have severe respiratory disease and their doctor thinks they need testing, they get testing. So the CDC, again, just changed that criteria, and that kind of changing response, adaptive response, is what's happening every day right now.
It's ironic that we just had this big vaccination fight in New Jersey, in Trenton, and it turned out that the anti-vax people won, and now you have the whole population wanting a vaccine.
That's right.
For knowing how important that is. It's amazing how things change in necessity.
It really is. You know, you have a disease that for whatever reason, be it the media coverage or something, is really scary to people. And people are clamoring for vaccine coverage when we've got an equally scary disease right among us right now, which is influenza, that we still constantly debate about influenza vaccines.
But to the original point, when we go back in our conversation, it's a shame that we don't get this much coverage about the flu, which kills substantially more people in this country. Another good thing that came out of it, I don't think the CDC's funding will ever get cut again.
Yes. Fortunately.
Thank you. Thank you for coming in. I always appreciate talking to you. Dr. Diane Calello, Medical Director at the New Jersey Poison Control Center. Still to come on Jersey Matters, a new and innovative way to recycle in New Jersey. We'll tell you about it when we come right back.